In South Africa, 2.3 million people have diabetes. 79% of them live in urban areas. 60,000 people die every year from this disease. In Johannesburg, it is the sixth biggest cause of death.
Last decade is the HIV decade in South Africa, and we are coming out of that. And now what is becoming more common is the metabolic diseases, which include diabetes, hypertension, hypercholesterolemia, and obesity. In addition to that, we are also seeing a problem and trend recently where HIV patients are also developing diabetes as a part of either because of the viremia or because of the drugs or because of the baseline risks of obese lipodystrophy and the fat, the insulin resistance which are developing. And so I think what you're seeing, and probably this decade would be a decade of metabolic diseases, which is becoming a chronic challenge, and diabetes being a part of that is, I think, is a challenge in Johannesburg. I'm very proud to say that diabetes is in our mayor's scorecard. So the mayor actually had 10 things which he is judged on, and one of them is diabetes, and 50% of the patient must be controlled according to his scorecard. I think at this moment what we are sitting around over 40%. So I don't think this is unachievable or too optimistic targets, because we started at 35% 2 years ago when he introduced this in the scorecard. So, I mean, obviously when we started, it was a bit of a problem because we didn't understand all the other issues. So in that sense, last 2 years, we achieved 5% move, and the next couple of years, I mean, we would be able to achieve the 50%. So I don't think this is unreasonable target. But what is more interesting for us, I mean, it's not just the 50% target, but I think it's the HbA1c, what I'm talking about, the control of HbA1c. We are also looking at the clinical outcomes. So these patients, when we are talking about the 50% target, they must be complication-free. And that's most important, that complication-free means that they shouldn't have any neural problems, neurological problems, eye problems, or any kidney problems. So these together, we talk about 50%. So it's quite complicated in that sense.
With a population of 4.4 million citizens, Johannesburg is the largest and fastest growing city in South Africa.
The executive mayor has launched the Healthy Lifestyle Program in 2012, and since 2012, we have been crisscrossing the city doing health education, especially on non-communicable diseases, which are diseases of lifestyle, getting partnership from the citizens of Johannesburg in living a healthy lifestyle to prevent non-communicable diseases. And those who already have been diagnosed with non-communicable diseases, to manage the diseases and to make sure that we have less deaths or we increase the life expectancy of our citizens.
Diabetes,
If we do not halt this escalation of diabetes, we are going to have a collapse in the health system, because the resources, the more diabetic people become, the more resources are needed in the health system, whether human resource or financial resources. But if we do not really stop this escalation, this can be a danger to the system itself.
Johannesburg is the first in Africa and the sixth in the world to join the city's Changing Diabetes program, following Copenhagen, Houston, Tianjin, Shanghai and Mexico City. This project was initiated by global healthcare company Novo Nordisk, working closely with local government and academic institutions. The team has been proactively and directly engaging with citizens to create awareness and promote healthy living.
We are providing comprehensive treatment or comprehensive social services in all our clinics in the city. We have improved the environment and the conditions in our city. In few weeks to come, we will be launching the e-health system in our city, which is part of improving the curable services. But we are also doing a lot in prevention. Like I said, that we are crisscrossing the city. We are working with the communities. We are working with NGOs. We are working in the wards in promoting healthy lifestyle, educating people on the importance of being physically fit, educating our people on how to prepare a healthy nutrition, what is nutritious food, and how to behave. Things like excess use of alcohol, cigarettes, or anything that can actually harm the health of our citizens. So we've been doing a lot of work. That is why when this opportunity to collaborate in the changing diabetes by the cities, we welcomed it.
A number of successes that we have reached is that we have launched a number of programs for instance, in South Africa. We have launched a Changing Diabetes bus where it went around the communities, and then we have been able to actually screen 40,000 people or more, and then where we actually managed to diagnose early about 7% of those people actually were diabetes, and they were not aware of, and then they were actually referred to the healthcare facilities. We donated a number of cameras in Chris Hani Baragwanath Hospital and in the Western Cape, that is a retinal camera to check for people with diabetes to detect the complication early.
Diabetes can be treated and controlled, but sadly, 1.4 million South Africans endure the disease undiagnosed. Then there are those patients who are meticulous about their treatment, yet factors such as tough living conditions, lack of education and poverty make their battle that much more life-threatening.
There was an old lady from the township, which happened to be, she was from a house, a two-roomed house, which was, just 2 streets away. She was a diabetic. And her diabetes, Prof, wasn't controlled. She comes in monthly for her checks. She gets her insulin. Everything that a patient needed to do, she did. Even better than what doctors and nurses would do. But her diabetes was not controlled. She's been in and out of hospital through registrar's MMC. And we stood there and I said, look, it's quiet. There were about 3 or 4 patients left at about 2 o'clock. And there were 1 or 2 other doctors. So we said, where do you live, etc. So with the students from Wits, we said, why don't we just pop in? Because it was just 2 streets away. This is in Mpeleswini Clinic in Sedibeng. So Dr. Victor, myself, and the 3 students from Wits, we went with the old lady and we went to a house. And we looked at a 2-roomed house. She had a grandson who was unemployed. He was about 23 years old. And it was only herself and the grandson living in the house. But he wasn't there. She was getting a pension. And took us through the 2-3-roomed house, small kitchen, very, very poor. Very, very poor. And in the house, Mama, where do you sleep? She took us to a room, etc. Where do you keep your insulin? She, very, very nicely. Showed the insulin. It's on the windowsill. On the windowsill. Now what was the problem? The sun was shining. It was summer. Directly on the vial where her insulin was.
What Dr. Bismilla's story tells us is that the struggle against diabetes will not be won by mere knowledge of the disease and handing out medication. A deeper understanding of people's backgrounds, traditions and living conditions is key to preventing and treating this and other diseases. In collaboration, the City of Johannesburg, Novo Nordisk and the University of the Witwatersrand will map the scale of the problem and understand the socio-demographic characteristics of individuals at risk before implementing a long-term plan of action.
What academia and local government, national and primary healthcare and tertiary care have decided to do is rope in the university. So we're going to harvest medical students to work in the clinics as part of their teaching block, and they will help us sample. So in other words, it's quite easy. If they don't do it, we fail them. They repeat the year. So what we're going to do is interdigitate student teaching, registrar training with diabetes care, and we're going to do it at at local clinics where health will be in the hands of the people. So our students will help us measure what that 50% is and what we are missing.
Eliminating sugar and increasing fruits, vegetables and whole grains in your diet are some of the ways you can prevent diabetes, along with regular exercise.
We don't mean that people should actually be going to fancy gyms or things like that. Just walking and then going up the stairs, less use of lifts, and then just walking to work or to school. Those are some of the things that we actually need to encourage people to do. When you have a family history of diabetes, then make it a point that on a regular basis you must go and check. If you reach a certain age, it is more important that above the age of 40 have at least annual checkups.
We have a long and short-term target as a city. By 2040, we want to see a city which is free of lifestyle diseases. We want to see a healthy city in totality by 2040, but in a short term, we want a reduction of new infections, of new people who are diagnosed with diabetes.